All right, so as the exercise physiologist, what do you think I'm going to make you do? I'm going to make you stand up. Stand up. Get up. And get some movement here. So catch the ball up. Don't break your pretzel. Don't spill the drinks, you know. So we figured, you know, we've all been sitting all day, so why not get a little movement, you know. Take out your aggressions on your neighbor. Be gentle. All right. See, and look at that. You're now all exercising, whether you love it or not.
I think we're done for today.
Exactly. Thank you very much and goodbye.
Thank you, everybody. Sorry I tripped your drink. I'm so sorry. All right. I feel like back in the 90s in a Simple Plan concert. 2000s. All right, we're going to put the balls to rest for a second. Thank you. Maybe. So, I'm NJ, and we're going to talk about two very important things about cancer. I have a full disclosure, and it's that I'm not only a doctor, I'm also a care partner. And a care partner to my mom, and a care partner to my dad. Both of them have cancer, and I'm the primary caregiver. Yes, I do have siblings, but I'm the oldest. So I'm the designated one. So let's start with the basics. Lung cancer survivorship. Lung cancer survivorship, it starts the moment of diagnosis. That moment that you remember. My mother remembers the date. She remembers what she was wearing. Raise your hand if you remember what you were wearing or what happened that day when you go cold. You can remember the time, and that's the moment when you became a survivor. Survivorship is not the patient that's off therapy, the patient that's doing well. No, survivor is the one that second, that phone call, you became a survivor. But we talk about curves, and all these things are very important. However, survivorship is physical, side effects of the medication, the cancer itself, the changes that your body has, mental, the anxiety, the scan anxiety that is so real. I have thoracic outlet syndrome, so I have to get angiograms every 6 months. You know that feeling when you feel like you're going to pee yourself and the CT scan with the contrast is hitting your body? That's very hard to explain, but that is part of survivorship. You feel warm and you're like, I don't want to pee myself. The emotional aspect, and I'm going to be here. How our things are going to go. The financial aspect, we don't forget. Cancer is extremely expensive regardless of where you live. You don't know working. Parking. I used to be at the Mayo Clinic. Why do we charge for parking at Mayo? I didn't know. There's just cornfields everywhere. There was space. The social aspects. You may not want to hang out with people for a while because you're so tired of being treated differently. My mother asked me to keep her lung cancer diagnosis for 2 years. One few people, Dr. Leo was one of the few people in the world I knew about my mom, was because I asked, because she didn't want to be treated differently, and that's lung cancer survivorship. You get tired of being offered a chair when you don't want to sit down. So that's survivorship. But there are many things that affect survivorship besides the pill. So let's talk about everything but a cancer pill today. Your outlook is very important. Cancer and mental health come together. How you look at things. Ross and I were just talking about his 90-day challenge. He tells patients to get an activity in between scans. And I love that. Your mind is somewhere. My mom decided to travel the world, sponsored by the Florez Lab. And then she forgets her scans now because she's planning her new trip. She has been in China, Thailand, Russia, the Patagonia, Alaska, Egypt. The other day, I thought she was going to become a 90-day fiance. She was taking a lot of pictures with these very young men. I was like, be careful over there. But your activity level affects your survivorship. And I call this the sorry couch, which is very hard. When I told, if you're on the couch and you're not moving, nothing is going to get better. The lack of movement is not going to make the symptoms better. Maybe the joints will feel better for a little bit, but that will have consequences later for your mental health, your social health, and your capacity, and then the guilt that you didn't do. However, everybody here is allowed to have a lazy day. Everybody is allowed to have a bad day. And if you want to watch The Real Housewives in New Jersey on repeat, be my guest. You get to do that. You want to see Teresa lifting that table again for the 20th time? You can do that. If you know the reference, we cannot be friends. Schedule burden also affects survivorship. How are your appointments scheduled? How close? How far apart? What are the time between the scans and when you see your doctor? Are you going to be able to have that self-control of not checking your scans before you see the doctor? That's extremely hard. Thank God my mom doesn't speak English. But otherwise, that is survivorship. You know, you're like, do I check? Do I don't check? Did I understand what it said? Did I overread this? But there are many other aspects that affect your survivorship. Weight gain. Yes, we're going to talk about weight gain and ALK positive. Skin changes. Your skin becomes very dry. You get skin rashes. The vulva becomes very dry. The vulva, to the people who don't know, is the part outside of the vagina. You have changes in your hair. Raise your hand if your hair is extremely dry, so you just started your TKI, right? That is a side effect. That's part of survivorship. And it's important that your hair is hard. Coconut oil, wonderful for TKI hair. Very cheap. You can buy it in Costco. It's also a great vulva moisturizer. 2 reasons already for coconut oil. It's good for cooking. 3 reasons already. So there are things that can be used for this. Faith is important in survivorship. Regardless of what you believe, you can be agnostic, you can be an atheist like my father, or you can become very Catholic for a year like my mother and then drop it again. That is okay. But faith is important. That is what sometimes makes things bearable. Hair loss in many different ways, hair thinning, and the cancer stigma. Because patients with lung cancer face something that many other patients don't face, which is the stigma of the disease. My life changed when I saw an obituary of a patient. And I ask you to Google Dr. Duma, different name, back then. Please don't tell my family. And that's how I learned that my patient told their family that she had breast cancer, and her obituary said breast cancer, because of the stigma of lung cancer as a young woman. And that day, I told my mentor, Alex Ajay, that I wasn't going to be a phase 1 trialist, and I was going to focus on young patients with lung cancer, because that stigma is not fair. Gender roles also play a role. Do you have to take care of children? What is your role that you have at home? I'm going to give you a real example of survivorship because it's different for everybody. These are 2 different types of survivorship. These are my parents. So for my mom, survivorship, and I switched because this is what gender roles are. Everybody would think that cooking dinner for the family was something that my mother wanted to do. Nope, 0 interest. She didn't care. My father learned how to cook as part of his survivorship, a part of his experience, his 90-day challenge. Now he cooks. This man is a surgeon. He didn't even know how to turn the stove. So that's what he learned to do. It looks very different, right? So now he wants to make meals for me. And I was like, man, you're a bad cook, but sure, let's do this. And my mom decided to travel the world. So survivorship looks very different to everybody and doesn't have to be associated with gender, right? My mom doesn't have to be the one that wants to cook, and my dad doesn't have to be the one that travels. It's different. Any symptom or side effect that is affecting your self-esteem and your quality of life deserves to be discussed with your oncology team. Because if it's affecting you, you're thinking about it every day, or at least 3 times a week, or something that you have in the back of your head, it deserves a discussion. Doesn't mean you have to suck it up and be a super survivor. Because sometimes those symptoms are the beginning of something bigger. And it can be a little tip for your oncologist to say, oh, maybe we need to do scans. Palliative care or supportive care is there to help us. It's not the end of life. We have to change it. At Dana-Farber, we changed the name. It's no longer palliative care. It's supportive care. On Friday, I had a 3-way call with a supportive care doctor, my patient, and I. We had a 3-way call. I felt like it was back in 2001, having this 3-way call. But we talk about early intervention of symptoms. So symptoms control is as important as the pill. This is the part in what I ask people to intervene. How do you express love to yourself now with cancer is very important. Yvonne, I know you were right there. How do you express love to yourself?
I mean, I think it's about time and how you choose to spend your time. So whether it's taking more time with family, with friends, and also saying no to things as well, where before maybe I felt an obligation to do things.
Correct. My mom says that after her lung surgery, she stopped wearing a bra for 6 months. She's like, this is the moment of my life I have a real excuse. That's self-love. She didn't wear a bra. She's like, don't want to. It's like, is the neuropathy still there, Mom? No, I just don't want to wear it. So expressing self-love to you means caring for you, right? And this is what we're going to talk about. Saying no is self-care. That's complementary medicine. If you have a cousin that you don't tolerate and she's having a baby shower and you don't like baby showers, you can say no and no go. All right? That is also self-care. That's self-love. I hate baby showers. They're not for me. Let's talk about body image and sexuality. Everybody here has a homework. And if you know me, you know what the homework is. I want to ask you to get naked in front of the mirror and see your new body, this body that the cancer has affected in many ways, and tell yourself 3 things that you love about this new body, right? My mom, I asked her to do it naked by yourself because we're so afraid to see ourselves naked in the screen, in the mirrors because of society and many factors. But it's actually liberating. And this is naked in your bathroom, all lights on, okay? Because I had a patient say, I did it, Dr. Florez, and the husband, she didn't turn the light on. So look at your body as a beautiful thing that has allowed you to have more experience, has allowed you to tolerate the TKI, has allowed you to have the scans. Thank your kidneys for tolerating all that contrast that we're giving you. And there is no a talk for me, at least a talk about sexuality, right? So sexuality is part of self-care, and body image is very related to that. Your body image, your just self-love, relates to your libido, okay? You don't have to be sexually active if you don't want to, but if you're interested, there are many things that can be done. Coconut oil, right? It's a wonderful bulbar moisturizer. Very quick story. I have a very traditional Catholic patient. She's from Portugal, and she has vaginal dryness. Like, well, let's get some lubricants. She's like, I'm never going to go to a sex toy. It's like, okay, let's get it in Amazon. Flip phone. Okay, flip phone is not. Can I ask your daughter to order the lubricant for you? No. Okay. I can walk you to the gift shop. No, I don't want anybody to see me. What if he goes sees me? It's okay. Coconut oil it is. I talked to the sex therapist. 2 months later, she went to Costco and made little Ziploc bags of coconut oil outside of my clinic, and I give it to every single patient here. And then I'm like, I see all my patients. And then this big person for clinic says, like, she cannot be doing that. And then I was like, okay, I think we need to chill in the coconut oil a little bit. Complementary medicine. What is complementary medicine? These are our therapies that help with side effects, it helps with the cancer. But there's a very important difference between alternative and complementary. Alternative is instead of the TKI, instead of the chemo. Complementary is to supplement what you're on. We support complementary medicine that's safe and that doesn't get you to go in financial ruin. Because a lot of complementary medicine can be very expensive. You need to be very careful with that. Because there is a $3 billion industry for patients with cancer about complementary medicine. So let's talk about what is complementary medicine. Meditation is complementary medicine. You can get free apps. Many cancer centers have free apps that you can download. You can have, we're going to talk about exercise in a little bit. You can have many things about complementary medicine. They're not that expensive. I'm going to show you my complementary medicine that I carry with me. And no, this is not drugs. I believe in valerian tea. It helps me sleep, so I travel with my tea. That is complementary medicine. Valerian tea in low doses with chamomile has been proven in clinical trials to help with anxiety associated with cancer. You don't have to buy David's tea. You can buy any brand you want, but I like the Canadian. So this is a form of complementary medicine, right? Other stuff, sunscreen is a way of love and self-care that we often forget. TKIs, chemotherapies, therapies put you at risk for sunburns, right? You can have this type of complementary medicine, and if you have been in any of my talks, you know what these batteries are for, okay? So travel with batteries or buy one that's rechargeable. But these is things that will help the journey, but most importantly, have a conversation with your doctor to make sure they are safe. Social media has brought a lot of certifications that are unknown, like, hi, my name is Amy X. I'm a certified holistic, call it. And you're like, okay, she's certified on something. And then you hear these things and you don't know what to believe. There's so much information coming your way. So having an open conversation with your oncologist, and most cancer centers have complementary medicine specialists that can go over the medications with you, over the supplements with you, because there are some things like coffee ground enemas that have been studied over and over again, and we haven't seen a difference. But they're $10,000 to do a set of coffee ground enemas. And I see it in your face. Why they're so expensive? It's leftover coffee. Don't know. But it's very good for your plants, the coffee. There are many ways of complementary medicine. So let's talk about some of them that have been backed up by data, all right? The first, peppermint essential oil. Not to swallow it. Please do not swallow essential oils. But to put in your wrist, having shown compared to other essential oils to significantly decrease nausea. And you know that saffron brings constipation, so you can try peppermint oil to use it as a form to control for early nausea. You know, when you're getting squeezy, you think the nausea is coming, you can have that roll-on of peppermint oil. Other things that have helped, hydration. It is hard to drink water. Let's all be very honest. It's hard to drink water. Doesn't matter how fancy my water bottle is, I'm still in a constant status of dehydration in clinic. But there are other ways that you can hydrate yourself. Coconut water is a forgotten one. If you don't like it, I get it. But coconut water has electrolytes. It can be a little more fun. That's a way to think outside of the box, right? It doesn't have to be Gatorade. It can be coconut water. It can be water with cucumbers and a little bit of mint. That makes you feel like you're in a spa without the spa prices. And like my patient for Jamaica say, cucumber, you brings actually a lot of electrolytes and it's easier to drink. Vinegar soaks for nail damage. 1 cup of vinegar, 1 cup of water. It helps kill the bacteria underneath the nail, and it's cheap. You can get your vinegar for the Dollar Tree store. We use chlorhexidine for regimens like Mariposa, but it's the same concept. Ginger. Ginger helps with nausea, and it's safe. There are many ways to have ginger. You can have ginger chews, you can have ginger tea, you can have ginger root. I had a patient that loves chewing the root. That's her call. But of course, everything in moderation, right? You're not gonna, go in a ginger spread and get crazy. Constipation. Alectinib gives constipation, so prunes. Diet, that is complementary medicine. There are many ways. Chia seeds, for example, can help with the constipation, without the urgency of Dulcolax or having to have a suppository. So learning about all these other things that are grandma's recipes, and you know what they're grandma recipes? Because they work. What do you think a grandma passed it to another grandma? Generational ways. Senna was used by the Egyptians when they were constipated. The Senna plant in the Nile River has been around for a very long time. But we cannot forget one of the best complementary medicine, sleep. Sleep is very important. So you can carry your valerian, like me, my valerian roots, but the sleep is part of care. It's part of self-love, it's part of cancer care, and we cannot forget that. You don't need to be a super survivor that goes in 4 hours. Your body is going through a lot, and sleep is a wonderful therapy for that. Sleep. And if your spouse is snoring, you have my permission to kick it out and say, I need a good night of sleep. And you can say, Dr. Florez said that you are getting kicked out today, and that's fine. All right, so let's talk about some specific things about alectinib side effects. And some of these are very common to you, right? So we have constipation, edema, fatigue, we get very tired. We can have muscle pain. And you think, do I need to take a pill for each one? Well, actually, no. Exercise, and Mrs. Campbell is going to tell you how, is a good treatment for all of those side effects. We don't have drugs that can cover all of that. Exercise can help with the fatigue induced by the alectinib. Exercise helps with the constipation. It helps move the swelling in your legs, and also helps with the muscle pain. That's one thing that you can do. And it doesn't have to be like you're becoming a CrossFitter or you have to run a marathon. Walks like the walk that we did this morning has a lot of value. Staying active is one of the best complementary medicine. And you don't have to buy a Peloton walk, a Peloton bike. It's cheap. There are many things you can download, watch, and do at home. Let's talk about weight gain in ALK therapy. This is a common question in clinic about GLP-1 inhibitors. These are medications that slow down your track so you feel full for longer so you don't eat, right? There are two ways of weight gain when it comes to cancer. The emotional weight gain, which is associated with the self-feeling of eating and you feel better. Usually it's associated with carbs, right? Nobody cries eating a head of lettuce. And the medications. The medications give you weight gain. So alectinib 10 to 12%, lorlatinib 22%, and the weight that patients gain is abdominal fat. It's mostly fat. There is new data about these inhibitors. However, they need to be done carefully with your doctor and under the care of an endocrinologist or a weight management expert. And I'm being careful when I say this because now you can get these drugs anywhere. Every time, maybe because I'm getting married in 3 months, but every time I go to Instagram, I have an app that says, get Ozempic off label from whatever company. These are compound medications, the ones that you buy in Hairs or whatever company. So it's very important that you use them carefully because one, they can make side effects of the drugs worse. The drug stays in your body longer, in your belly. The constipation for alectinib, it will get worse with the GLP-1 inhibitor. If you have a lot of nausea, it will get worse. It also can affect alectinib benefits when you have food to absorb the medication, right? So if you are in these drugs and you're not eating all day, it can affect some of the drug absorption. And you can lose muscle mass with these medications. They are common, but you have to be carefully using it. I have patients in GLP-1. Dr. Tejas from the University of Colorado and I are putting a group. We have over 50 patients we are experienced with GLP-1 inhibitors. But I want to make sure you do it carefully and that is monitored closely. It's an evolving data about this because your drugs get metabolized by your GI tract. It's very different than people that get chemo, immunotherapy that goes in the vein. This goes in your stomach. So yes, they can be used, but appropriately, and sometimes they're very expensive. So you have to be very careful about the added financial toxicity. Another complementary medicine that's super free is meditation. Meditation has been done by members of the armed forces to a point that they can sustain pain to active bleeding through meditation. It's one of the most powerful tools that we have that we often forget. And in YouTube, there's a million guided meditations. So last night in my flight, I have fear of flying. I was meditating in my flight. I was doing this guided meditation that just talks about me going up a mountain. And then I fell asleep and I landed. I was like, great. Improves well-being, it helps with pain management, but this is not meditation. Meditation is playing and you're in your phone scrolling. No? It's meditation in which we stop. It helps you with better sleep, it strengthens, all of this is backed up by data. This is just not me saying. Immune system. How many times did we talk in the focus group, what else can I do? We just talk about meditation is one of them, it's free. Exercise is free. We talk about ginger. There's some data about ginseng. But most importantly, the conversation. But all of these things are things you can do more. You're wondering what else I can do more? Meditation. 10 minutes of meditation a day has helped anxiety and depression to similar levels than drugs. And if you have problems with sexual health, antidepressants don't help with that, right? So guided meditation, if you're not good with technology, ask your kid or ask anybody to download one of these apps. Headspace, there's so many, Peloton. I do Peloton guided meditations. I do it before my clinic. I do 10 minutes of empathy guided meditation before clinic. Every Monday, every Thursday. And it really helps me to be a better doctor. All right, 5 ways to get mental peace. This is complementary medicine, managing your family and managing your friends. This is part of complementary medicine. We forget about it. It's a full-time job to manage your family, especially when you have cancer for so long. These therapies are working for very long. My mom tells me, I'm just tired of answering the same question. I wish I could just have a t-shirt that says, oligometastatic, no evidence of disease, I don't know when it's coming back. Because she's like, every time I go anywhere, it's the same thing. So how do you manage family, right? Because first, that family member that sent you the article about ivermectin, that's a way of love, but don't take that medication, all right? There are medications that are very unsafe. You have to be very careful. Those medications were for other uses. But that's a form of love. Your family sends you articles because they don't know what to do. Until now, you were healthy, right? She was healthy and all of this happened, what I can do. So you get these text messages, these Facebook articles, these WhatsApps, these audio notes, and they're a way of expressing love. Instead of going in that rabbit hole of that text message, just say thank you and do what works for you. You have no commitment to do what they're telling you to do. Oh, but this lady drink apple cider vinegar every day. Had you seen the documentary? It didn't work out at the end, right? So be very careful, but that's ways of love. So how can you do to manage friends and relatives that are showing love? One, ask for practical tasks. Oh no, whatever you can help with. That never works, because people's like, what can I help with? Can you go and pick up my groceries at Target at 5:30 p.m.? I already ordered them, but I'm having a bad day. Practical tasks. I take care of young patients, and a lot of their families like, what can I do? 2 hours of babysitting. That's what you're gonna say. Practical tasks really help, because otherwise, people's like, oh, but you don't tell me what can I do? Practical tasks and zero guilt. They're offering the help after all. And if they don't do it, then it wasn't true. And then we call that one fake help, and you move on. right? Practical tasks. Can you please help? When my father had a very hard time with his cancer, he's very hyperactive and independent, and I have to have a talk with him. It's like, I need to help you. Let me help you. And telling a Hispanic surgeon man that he needs to take help was hard. So I started with practical tasks. I'm gonna tie your shoelaces. That's my job now. Because every time he did it, he got dizzy. So I tie his shoelaces. So practical tasks. Bring somebody with you to appointments, and if you cannot do it in person, FaceTime. Ask your doctor though. Ask your doctor for permission. FaceTime, audio notes. There are many ways you can do it. Video, phone calls. Disconnect when needed. That, I'm gonna stop for a second. That's so important. You don't have to be a super survivor every day, and we talk about this. You can have days, just notify the key people, all right? Just notify your care partner and saying, I'm taking an off disconnect day. Because you get tired of scrolling in TikTok about the new cure or whatever cancer, or you just tired of watching the news and seeing that cancer funding is being decreased every day. So you have the permission to turn off your phone, put it in no disturb mode, and just be by yourself. 5 plans for your kids, 5 plans for your spouse, and give yourself that self-love. That will make this journey better. I told my mom, when is the last you stopped talking to your, because they talk a lot, my aunts, they talk a lot in a WhatsApp group. So I'm like, you need to disconnect from the WhatsApp chat this week. Give yourself that. Watch bad TV that you don't need a brain cell. You don't have to watch a documentary every single time. You don't have to learn every single time. You can just watch American Sweethearts, which is my current obsession, the cowgirls, cheerleaders. And that's okay. Disconnect. That is self-love. That's cancer care. And also, put someone in charge of sharing social news. If you don't feel comfortable sharing the news, that is who I am for my mom. My mom is like, nope, talk to Narjust. So you put a designated person. And lazy days, and don't compare yourself. This is also another treatment with people on social media. Don't compare your insides with people outside. You're gonna see that cancer survivor who's like in CrossFit and vegan, and is always having a good day. That is what is in social media. Like, I got engaged in December of 2023, right? I didn't post it in social media for 3 months. And people think that, it was real time. I was like, nope, gotta finalize the divorce first. So, don't compare yourself with other people. And this is my last slide, and this is what put all of this session together. We came with Angus, we came with Nancy, we came with Martin and Paolo to talk about the power of physical activity. But my take-home message for you is there are many ways to treat side effects outside of pills, and there are many ways in which we forget to care for ourselves that make the journey harder. Sleep. Sleep is important. Get the hours that you need when you can. I have young patients. It's very hard. I have one that had a 9-month-old right now. Like, we're struggling with sleep. Sleep, ginger, valerian root, chamomile, meditation, stretching, talking to a friend about something that has nothing to do with cancer. There's a new article that shows that your quality of life improves if you have healthy gossip. Let me explain healthy gossip. Healthy gossip is when you don't destroy anybody, it's not negative, right? It's like, ooh, did you hear that Max Verstappen may go to Mercedes? That type of gossip. If you don't follow F1, I'm sorry for you. But the gossip of many things, like talking to a friend, is complementary medicine. Those 8 minutes is complementary medicine. So now I'm gonna let the microphone to the expert on exercise.
I'm really tempted to find those beach balls again. I don't know, that was fun. I'll spare us all that. But let's see. So I kind of wish that we had done that interactive piece that was up earlier, because I always love to ask people when I say exercise, like what comes to mind, and because the answers are not always positive when I ask people what a word association comes to mind for people when they think of exercise. But I'm hoping by the end to maybe have some of you who maybe don't think of it, aren't Kirk and didn't like bound out of bed this morning, like so excited to get out for that walk, that not all of us are that energetic. We can aspire to it, but knowing that we also don't have to be, and realizing that maybe for some of you, exercise is equivalent to me standing in front of all of you and the amount of anxiety and dislike. So, we'll look at it in different ways. So we have this fabulous little woman walking across our screen here to give you some benefits here. Some that we have heard of already today. So improved physical function, so being able to get up and move around, that is always helpful. The enhanced mood piece, we have Kirk as a living example of that. Better energy, and this is the super counterintuitive one, and I'll have a slide a little bit later about the fatigue piece, but ironically, this is one of the things that may not come to mind, but is actually fantastic for fatigue. Improved respiratory function, big quality of life, we've heard about that. Your ability to tolerate treatment side effects better, so that's a big one. And improving recovery and sort of post-treatment here. So as we go to our next slide, so the American College of Sports Medicine is the organization that I fall under, and I have been at the Farber now for 20 years, and in that time, the amount of studies that have gone on and the benefits that have been shown have been quite impressive. So, we went over most of these, and we see, at least from a recommendation standpoint, and we'll break this down a little bit, we see really good benefit from an aerobic exercise standpoint of, 3 times a week, 30 to 60 minutes, but not letting, if you're currently not doing anything and you're seeing this number and you're like, okay, lady, whatever. This can be in 10-minute chunks. This doesn't have to be a 45-minute walk. We can break this stuff up. Resistance exercise. We don't have to join CrossFit. We don't need to go have a fancy gym membership or buy these things. We have our own body weight. We can be doing, squats. We can be doing wall push-ups, things like this to incorporate movement. So next, I wanted to talk a little bit about the challenge trial. Now, some of you are probably looking at the screen saying, does this lady not realize we have lung cancer, not colon cancer? So this was a very large trial that was actually at ASCO this year and got a wonderful reception across the board. This study got started 20 years ago. It took them this long to accrue everybody and look at the results from this. So they took folks after treatment, and half of them got randomized to a structured exercise program, and then the other half got health education. Almost 900 colorectal cancer survivors in this study. So it was a very large study, so partly explains why it took so long. And we see a little bit about what was involved with this. They slowly phased people up, because people in this case were coming off of treatment, and they were trying to increase the amount of exercise they were doing. So the goal was to increase by 10 MET hours. And most of you, like me, were like, what in the world is a MET hour? Never heard of such a thing. So an hour of brisk walking is about 4 MET hours. They found in the study that most participants could hit their target by adding 45 to 60 minutes, 3 to 4 times a week of walking. So it's not no walking, and no exercise, but it's also not this need to join a gym, do all this, invest in all these things. It's, having a good, pair of sneakers. And they gradually increased the amount of exercise over time. And you might have thought we were done with the Kaplan-Meier curves, but one more to end the day here today. So this study really wanted to pit exercise against, and look at overall survival. So we see that split there, and then what the authors did was kind of then compare this to other treatments. So at the very top, we have exercise. So overall survival, a 7% improvement in 8 years. This is on par with many of these drugs that we see listed below. But what I always like to point out, with no side effects. We're not dealing with dry hair and dry other things that coconut oil helps with, and things like that. So we're finally, we often say in my field, like, exercise is medicine. Well, now we really have sort of data behind this, that it's not just sort of a nice thing to do or a good thing, that we see, at least here so far in colon cancer, that there is a survival benefit that is on par with many popular chemotherapy regimens. So it took us 20 years to get this study. I don't know how long it'll be to get the next one, but I'm hoping that this will also kind of get this on the mark, and so that more community centers, or really even major cancer centers, have somebody like me, an exercise physiologist, on staff that you can go and meet with, that you can join an exercise class with. That just doesn't exist in most places. I'm very fortunate at Dana-Farber to have been gainfully employed there for as long as I have to do, we offer a tremendous amount of free classes and content that I know is not available to all of you, but I do hope that studies like this will help, kind of get more awareness, get insurance companies, to pay for programs like this now that they can see, that there truly is this overall survival advantage. So, if we step back here to our fatigue cycle, so this may look very familiar to many of you, that we have this actual concept and actual, cancer-related fatigue. I don't need to tell you all that it is not, your garden variety fatigue. So we see it at the top, and then what happens? You're resting. So then you're getting deconditioned. So then you're getting more tired. So then you're sleeping. And like, here we are in this vicious loop. And it's like, where can I break this cycle here? So I have this idea that I stole from somebody at some point that I like to think of as the traffic light approach, where you kind of get up in the morning and think to yourself, okay, how am I feeling? What kind of day is this for me today? Is it a red light day? Am I really, really fatigued, really feeling kind of crummy? What are things I can do when I'm having a red light day? And so maybe some examples are, okay, I'm going to do some stretching. I'm going to do some meditation. I'm going to do some breath work. Maybe I do some body weight exercises, but something, that's gentle, but also kind of keeps this consistency piece going, which I think is important with exercise, that we don't just, kind of have this all or nothing of like, you leave the talk today, you're super motivated, and you walk for the next, 10 days straight, and then you're exhausted and you don't do anything. So, having those, okay, I'm having a red light day, what's something I can still do for my self-care to, kind of keep myself moving forward? If you're having a yellow light day, maybe it's a lower intensity or a shorter duration of something you might normally be doing, or lighter weights if you're doing some strength training. And then, green light day is, as, feel good to you. This could be walking, but maybe it's a bike ride. Maybe this is yoga, maybe this is strength training. This could be literally turning on music and dancing around your kitchen. This doesn't need to be fancy. This could be finding the beach ball and tossing it around with your neighbors. So, so some tips here. Starting slow. So if you're, you currently are not exercising regularly, we want to start slow with things, and we want to be kind to ourselves. That we may not all live up to Kirk's expectation in doing all this exercise, but we're going to do what we can do on that day and acknowledge that. If you have listened to the podcast, there was this concept called the 10% rule that I think many people left that podcast with. So that rule, I guess we'll call it that, is that 10% of something is better than 100% of nothing. So always keeping that in mind on the days that you don't feel up to going on your normal walk or doing your usual things, that even a couple of minutes of like laps around the kitchen island, you know, that all counts. So I tend to be a big proponent of strength training. I teach our strength training classes at Dana-Farber. I like this little quote that I stole from Dr. Howard Lukes, that strength training turns your muscles into an internal pharmacy that fights inflammation and promotes healing. So big proponent of the strength side of things. Focusing on consistency. As you know, I mentioned before, we just don't want to go kind of like all or nothing with this. That we have that red light, yellow light, green light, you know, and doing what you can. And then really, you know, asking for help, seeking resources. You know, I've been at Dana-Farber for 20 years. I can't tell you at least once a month I have a patient or, you know, a physician, another provider who are like, oh, are you new? Did we just hire you? Is this a new thing? I'm like, it's just in 20 years, you know, it's fine. I just the other day. So even within Dana-Farber, there are, you know, people that have no idea that I exist. So maybe at your cancer center, there is someone like me that you had no idea existed that is there. Physical therapy can be immensely helpful. I'm hoping that many of you have taken advantage of that, and if you haven't, that can be great. And you may, you know, actually have to ask for this from, you know, your oncologist. Sometimes they're not going to necessarily have it front of mind, but asking them to put in a referral. Anyone done Livestrong at the YMCA? Excellent. Okay. So free program that's offered at most YMCAs, but not all YMCAs. I put the website there where you can go and look and see if your nearest YMCA offers this program. So it's free for 12 weeks. You meet twice a week. And you know, you're in sort of a small group. It's not personal training, but you're also not there with 50 other people and there's one trainer and you're just sort of lost in the weeds there. So it can be a great way to get yourself consistently exercising. You've got free access to the Y for 12 weeks, so you can go as often as you want and take advantage of their, you know, different classes and things like that, and just a nice chance to meet some other survivors, have trainers that understand, you know, what the different side effects are. You know, often maybe the typical trainer isn't aware, as you all know, the average trainer is going to look at you and think, oh, okay, here you go. Here's 50 pounds. Here's this. Like, these trainers are going to, you know, have some training and understanding these pieces. So that piece can also be helpful for people to kind of make them feel a little more at ease. And then the Zakim Center, where I work at Dana-Farber, we have, you know, we have a lot of in-person classes and Zoom-related classes for those of you that might be patients at Dana-Farber, but I'm going to assume the vast majority of you are not. So we have a very large library of, you know, 500 plus YouTube videos out there in lots of different movement types of classes that we have listed here. We also have these little toolkits, and so we have a neuropathy toolkit and we have a sleep toolkit where different providers from the Zakim Center have given you, you know, tips and suggestions and things like that. You know, so a great free resource for you to, you know, check out our videos. We have, you know, you can go by time if you just want like a quick 10 minutes of stretching or 10 minutes of strength, or you want to focus on, you know, a certain piece. Or like a full class. My classes are typically 45 minutes, so you know, that's free to all of you. You can take advantage there by the website there at the top. And you know, again, your cancer center may have an equivalent. You know, certainly Sloan Kettering has an equivalent program. You know, MD Anderson, a lot of these larger cancer centers, but you know, you never know what might be happening out in the community. So I encourage you to check those things out. Check out our website at Dana-Farber. And that's actually my last slide. Yeah. So thank you all.
So we have some extra time, and I want to ask Nancy a few questions that I think are important to patients. If anybody here wants to start tomorrow, increasing their physical activity, what would be your recommendation? Like, Nancy, I want to get moving tomorrow. What can I do?
I know this can be, whether it's laps around your kitchen island or to the end of the driveway and back, finding, an amount that feels doable. And then, trying to add, we usually say no more than like 10% a week. So if you're starting with, you put on your favorite song right now, and that song is 3 minutes, and you dance around your kitchen for 3 minutes, that's great. And then, maybe next week you try to find a song that's 4 minutes, and you do, a little bit more. So we don't want to, just go kind of straight all or nothing and start doing too much, but, starting slow. And then sort of this concept too of asking for help is there somebody, we were talking about tips, like, is there somebody that will go and walk with you? People are often looking to help. So is there someone that will be your walking buddy, and they might physically walk with you, but maybe it's just sort of an accountability partner, someone that you say to them, okay, next week on Monday, Wednesday, and Friday, I'm going to walk for 10 minutes. And then at the end of the week, you check in with each other, did we do it? Great. So I think that piece, and I know even on the Instagram page, I think her name is Kristen, does some great, videos and exercises on there. So, checking these things out, these sort of short, digestible, ways of getting some more movement into your day. Or just grab a beach ball and start throwing it around with your neighbors.
So all those videos in the Zakim Center are free and accessible to anyone.
Mm-hmm.
And include all the tips that we talk about it. It's not promotional material for Dana-Farber. It's just a place to where to start. Mm-hmm. I have people in your program, and they love it. But there is a point in which the motivation goes down. What is your recommendation when that motivation goes down? And which we all have gone to TJ Maxx and bought a bunch of matching sets because we're gonna start the gym, right? Lift your hand. It's like, I bought everything. But then, how do you deal when that motivation goes down?
So I think part of it is, this idea that motivation's kind of a little bit of BS. Like, we all struggle. I'm sure even Kirk would say there are days where maybe he doesn't bound out of bed and want to do this stuff, but it's more about that consistency piece that you're like, nope, on Monday, Wednesday, and Friday, I'm committing to doing something for myself. And that's where you take that traffic light concept and you're like, I would rather have like someone return a journal to me if they're filling that out with a whole bunch of red light days where they're just doing 5 minutes of this one day, 5 minutes of this the other day, then bring back a completely blank journal to me, or bring back I did 60 minutes this day and then I didn't do anything. So it's more like trying to make that commitment of I'm going to do something for myself every day, and then I can pick and choose what I want to do that day. But motivation is not always going to be the best. More that consistency, carving out the time. I mean, some people are literally putting it in their calendar. Just like you put your doctor's appointments into your calendar, you're blocking time for that and really saying like, okay, I'm going to prioritize, this self-care time and putting that in there, and then something will inevitably pop up. You might need to reschedule it, so you look on your calendar and you say, okay, nope, I can't do that at 2 o'clock tomorrow, so I'm going to move it. I'm going to, just like you would move any other appointment. But trying to keep that time dedicated for yourself to do these things.
My last question to you is, we heard from patients early and their caregivers about brain fogginess, which is a common side effect for therapies. Can exercise help with that, and why and how?
Right. I mean, sometimes it's the anti-inflammatory pieces that exercise will have. Sometimes we see, like in terms of the brain, like new neural pathways that are being created from exercise. So we see it in, say, Alzheimer's disease and things like that. So it could be, a little bit of both of those things that are helping with the brain fog. And then sometimes it's, doing something new that you haven't done before. So maybe a mode of exercise you haven't tried before, or doing, a new strength exercise you hadn't, that's also kind of creating some new pathways in there, so helping you to feel better and more clear-headed. And maybe it's even just taking some deep breaths if you're constantly, maybe like I have been for the last 45 minutes, just taking these short, shallow breaths, like that deeper breath, getting that oxygen everywhere, including your brain.
Thank you, boss.